My name is Megan Cambron. I'm a licensed clinical social worker with the REACH program. REACH stands for Respond, Evaluation, and Crisis Help. One way we define trauma is it's an event. Usually it's a distressing event that's oftentimes life-threatening. We also sometimes define trauma as our body's response to those distressing events. So that can look like increased anxiety, detachment from yourself or from other people, maybe flashbacks about the event, nightmares, trouble concentrating. It can look like avoidance, avoiding anything that kind of reminds you of it. So we need to know what to look for and know that it's okay for everyone to feel those things after a traumatic event or in response to a distressing event. So knowing what to look for, knowing that it's kind of normal to feel those things, but then being able to sort of listen and validate that person's experiences and their emotions, just be willing to talk through it with them is really helpful. But also knowing that if those symptoms don't dissipate over a couple of weeks, if they're very intense, then really suggesting they reach out for help to kind of process that event with somebody in a professional manner. We're fortunate to have a lot of good resources here on campus, and so I would say the Counseling Center has an abundance of resources, groups and individuals, and even online resources that you can access. McKinley Health Center also has some really great resources available. The Women's Resource Center is also another good one. The Student Assistance Center can also be a resource for you if you might be falling behind academically because of a distressing event. I would also say UIPD if you want to report a sexual assault. And we have some really well-trained and compassionate folks who can take those reports from you.